Hi there, my name's Rebecca Williamson. I'm the publisher of Fierce Pharma, and I'm here today with Katie Cart, Chief Revenue Officer at Swoop. Katie, thank you for joining me.
Rebecca, thanks for having me today.
So tell me, given the evolution of pharma marketing in recent years, what do you see as the biggest shift in the pharma marketing landscape or the most disruptive influence?
Right. Listen, by far, the most disruptive thing in pharma today is the wave of state privacy laws. And, listen, it's really created an environment where we have to be very thoughtful about the way that we use data for targeting purposes, for measurement purposes, for personalization. And you really want to be intentional about the companies that you partner with. It's incredibly important in this landscape that you partner with a company that's grounded in privacy, someone who takes privacy as a first, as a first company first. It's essential that you look for a company that's credible, that's trustworthy, because at the end of the day, it's really important that we still are able to market to patients in all 50 states. But you really need to do that in a privacy-safe manner, and there are certainly companies out there that you can partner with that can do that in a privacy-safe way.
So talk to me, why is TV an ideal starting point for building a robust omnichannel strategy in pharma marketing? And how does TV's broad reach complement some other digital channels?
Yeah. I mean, listen, TV is the foundation for awareness, right? I think of it as the doorway into a really strategic omnichannel plan. And essentially, when you're thinking about pharmaceutical, it's really incredibly important that you're able to educate patients and, more importantly, build a sense of trust with your patients. And the best way to do that is with consistent messages, with consistent audiences. And you can do that with a really strategic omnichannel plan, starting with a credible, reliable channel like TV. And then when you accompany that with digital activation, with data, that's really when the magic happens, right? Consistent message, reinforce over and over again to essentially help educate your patients so that they can get on script sooner, stay on therapy longer, and are less likely to fall off.
So tell me, how can predictive targeting strategies be applied to mitigate financial losses associated with non-adherence and improve ROI?
Yeah, I mean, listen, I think adherence is one of the biggest challenges that pharma is faced today, right? It's no surprise that over 50% of chronic patients will fall off script. This is a $500 billion challenge within the pharmaceutical industry in a given year, right? And what predictive really allows for is this opportunity to have a window of time where you can have a conversation with a patient and or their associate provider to talk about, before they actually become diagnosed, before they actually fall off script, right? This would give you as a brand the opportunity to have a conversation about, educating them on why they should stay on script, maybe talk to them about the cost savings associated, and really build trust. So it really something that's incredibly important to marketers today.
Looking toward the future, what's one bold prediction that you would make just about the future of pharma marketing?
Yeah. Listen, in the next 5 years, we're going to see big pharma bring measurement in-house. And there are a lot of reasons for that, right? First, regulatory, right? If you own it, the compliance is okay because it's in-house, right? If you, credibility and transparency, right? So gone are the days of black box measurement and reporting, right? And then also there's this idea of, having a real competitive advantage by having this asset underneath the roof of your company, right? It essentially becomes a strategic asset that you can make smarter decisions, faster decisions about your patient connections, as well as where you're investing your dollars today.
Very good. That feels like the perfect place to wrap up. Thank you so much for joining me today. I appreciate the conversation.
Thank you, Rebecca.